Well, good morning and welcome. I'm Dr. Sherry McAllister. So excited to be here with you today. And I'm the Executive Vice President for the Foundation for Chiropractic Progress. The whole purpose to being here today is to share with you the empowerment of what chiropractic is doing in the media, being able to help you engage in conversations that are meaningful, utilizing research, talking points, and having all the resources that are going to be effective for you and your practice. So I'm going to get started because we've got 30 minutes of full excitement and energy that's going to help us move your practice forward. But before we get started, one of the keys that I think are going to be very important to the overall ability for chiropractic to promote in the national conversations is that we have proud corporate sponsors, one of which is today's Chiro Secure. We cannot promote chiropractic on a national basis without the help of both our associations, our colleges, our proud corporate sponsors like Chiro Secure, and you. So let's get started because we've got a whole lot to cover today. And what are we going to cover? The efficacy of chiropractic care, the PR trends, what's going on in today's world, and how does that affect your practice? What can we as a profession do as a whole? Marketing to the community for your practice, and then preparing for September because it's going to be a great month and we're all going to be in it together. I like to say this: we are chiropractic strong. And in this profession is where you belong. So we want to be sure to cover a lot of important things on the efficacy of chiropractic care this month. And we're going to start off with the research. One of the key aspects that I think is very important for you to know on a national level is the foundation's job is to ensure that our voice gets out to the media. And we've done so this year alone in Shape Magazine, the Washington Observer, the Managed Healthcare Executives, that goes out to 1.5 million in executives, the Employer Benefit Advisor, Healthcare Now Radio, and the American Health Insurance Plans. That goes over to millions of insured third party payers that are looking at what resources should be involved in their coverage. So, is chiropractic making its way in the media today? And I can assure you the foundation and you are making a difference. How do we know? We know because we get feedback. And one of those articles that came out, you don't post something unless we're starting to make news, is the Steven Salzbergs. Now, I know a lot of you are familiar with that article that was in Forbes recently, and his article, if you're not familiar, said, quote, Medicare data reveals 564 million wasted on chiropractors and osteopathic manipulation. Well, we took it to a higher level and not bought into his story, but ensured that we showcased ours. So if you haven't seen our media response and that what we said was positive press for chiropractic, just pop onto our website, f4cp.com, and you'll see media responses, and it'll showcase exactly what we said back to Forbes. We're still working with Forbes to see if we can get other opportunities to showcase the chiropractic profession and all the very important research that is coming out. And that's why this slide is up right now. What is the current research and how do I use it? Well, we have a growing list of randomized controlled trials. There are observational studies, there's clinical reports, but what are the ones that are going to be important? And one of the key studies as we start to showcase is the one that just came out. And I mean just came out, which was probably about 3 weeks ago, that was by Ian Coulter. This is a study by RAND. It updated a randomized control trial, evidence for these manual procedures, and it concluded, and this is the key, there is moderate quality evidence that manipulation and mobilization are likely to reduce pain and improve function for patients with chronic low back pain. Manipulation appears to produce a larger effect than mobilization. Both therapies appear safe. Why is that important? As we start making our conversations stronger, we need to have moderate quality evidence. And when you have and armed with information such as this will help us get our talking points in place to showcase what we already know. And that is that it is a important therapy, chiropractic has a multimodal impact and help patients, obviously, through utilizing the best quality research. Now, let's follow some of the other research. And here is a slide that just documents some of the other research. We've been in the American Medical Association. Be comfortable with these. If you don't know where to find these, go to our website. You'll be able to find the Definitive Chiropractic Resource Manual, and it is a booklet. It is green. I don't know if you can see my slide right now, my face, but it says Chiropractic, a safe and cost-effective approach to health. You'll be able to see a lot of the information that we have here. But when we start looking at some of the important aspects of the research, what I want to point out to you is when you start looking at spine in 2012, one of the studies that showcased in the Spine Journal is that we had a meta study, and it was titled The Prevalence Patterns and Predictors of Chiropractic Use Among U.S. Adults. And what this did was it took the National Health Information Survey in 2012, and it took that time period of the past 10 years. And when you look at it, the key findings, and there is a growing trend, which they put very nicely together for us, of the overall use of chiropractic. Research and reasons for seeing a chiropractor, the top line ones were back pain, 60%, neck pain, about 30%. However, there were other things that people were seeing chiropractors for, and this is what I wanted to share with you. The majority of users report chiropractic was helping them a great deal with the sense of wellness and health overall. And reasons that they said they were seeing the chiropractor included general health and disease prevention, to improve their energy, to improve their athletic and sports performance, and to improve immune system functionings. What are the key findings in this December spine article was that nearly 6 out of 10 patients, that's almost 57%, experienced a reduction in chronic low back pain and a reduction in disability by 78%. This was after their manipulation or mobilization as compared to other therapies. A majority, 79%, reported that manipulation significantly reduced pain and disability compared to the other approaches, such as physical therapy. Both manipulation and mobilization therapies are considered beneficial and safe. And that's not all. Users also reported the sense of control over their overall health. Control is really important when you start thinking about talking to a patient who's helping their family members. It helps them to reduce their stress and anxiety levels, and it helps them to sleep better. And these are all the improvements in health. Listen to me. There was a report that came out in the Wall Street Journal that talked about benzodiazepine. It was also covered in a number of different media sources. Is the next opioid crisis because it actually decreases the respiratory capabilities. And benzodiazepine is actually being used for anxiety, stress. One of the big ones that's being used is Ativan. We want our patients to have control over their health in a non-drug free way that's safe, that's effective. We know the differences. And the reason you're on this call today is so that you can easily communicate with healthcare providers and your patients and knowing why we're safe. Dr. Klum does a fantastic job of going over the safety of chiropractic, and he did so last year when many of you remember the Katie May story, and it hit hard, and we had crisis communication management across the nation. How do we combat such negativity? When do we talk to the media? And one of the things that I think is very important is that you realize that it's not if it's going to happen, it's when it's going to happen. And what are you prepared to talk about with your patients? This slide right here, if you don't know those top four, I urge you to get comfortable with Church's study, Kozloff's, Cassidy's, and Herbert's. Look at chiropractic care as a safe modality. Yes, we know there's some risks, but when patients with complex comorbid conditions would benefit from co-management, especially when we're looking at neck pain, considering more serious adverse events and you're looking at spinal manipulative therapy, you have to be comfortable that it's safe. And these findings are consistent with previous studies. You're looking at the increased risk of vertebral basilar artery dissection, stroke associated with both chiropractic and primary care. And they're likely due to patients seeking care because they're experiencing symptoms of headache and neck pain due to what's already walking in the office. When you look at the other studies of serious adverse events related to spinal manipulative therapy and low back, they concluded that any recorded events are anecdotal in nature and causality has not been established. So, let's talk about the benefits, the efficacy of chiropractic care. I know you know them, but do you know them in a way which you can communicate very effectively with a patient and talk the patient language? It's easy for us to throw out VBAs and post embolytic therapies, adverse effects that create contraindications, but a patient needs to hear it in a simple form. What do? We're reducing acute and chronic back and neck pain with improved function. We just saw that in the study I just presented in January of this year. We reduce upper and lower extremity pain. Patients need to know we treat shoulders, we treat legs, we relieve certain forms of headaches. And that happens to be next month's topic. So stay tuned because we've got a whole host of infographics, research papers, articles written just for you, for your practice, your newsletters, your media focus. How about relief from pregnancy related care? Or ameliorating hip, gait, and foot problems. You've got lots of runners out there. Are they talking to you about their foot pain? Maybe not. Maybe that's what you need to recommend is that they understand the benefits of chiropractic care, increasing the ability to perform their activities of daily living. And that's why we just had the recent Olympics. Let's talk to them about chiropractic in the Olympics because a lot of them, they won't know that chiropractors were an essential part of those that get injured and coming back to their ability to perform at that high peak level. Now, the other portion of this, as we all know, is that patients unfortunately are losing their lives. 42,000 of them reported in 2016. The numbers are coming out in 2017, documented. We'll see where it comes out. But prescription opioids are involved in 40% of all opioid related overdose deaths. So, what do we need to know? 115 Americans die every day from an opioid related overdose. This is very serious. So, what we want to make sure is that we're having that drug free pain management conversation with those that are in our office. It's easy to do. Just start the conversation of, did you know that the foundation that we have a white paper or an article that's written about drug-free pain care, and that chiropractic is working towards managing patients that are really looking for an alternate solution because we know that the majority of Americans are looking for a drug-free way to help their health. As primary care professionals, remember I'm giving you talking points. If we say the same thing, we don't confuse the media. As primary care professionals for spinal health and well being, doctors of chiropractic receive a minimum of 7 years of higher education. We're trained to diagnose, evaluate, and provide a drug free care and rehabilitation to injuries to the individual suffering from low back, neck pain, headaches, and neuromuscular conditions. Why am I telling you this? You know what you do, but the patient needs to be aware. And so feel free to utilize our talking points. You'll get them online. The solution is, and you have it documented, that the American College of Physicians Clinical Practice Guideline recommends utilization of conservative care, including spinal manipulation for acute, subacute, or chronic low back pain prior to prescription drugs. That's incredibly important in the healthcare community you are in right now. You are an answer, but the medical doctors need to know what you do. Doctors of chiropractic who perform 94% of spinal manipulation. Many patients don't know that. Many healthcare providers don't know that. 94% is a key piece for them to understand that we are doing the majority of spinal manipulation. Chiropractic care is documented to yield improved clinical outcomes, reduced cost, and high levels of patient satisfaction. In fact, just so you know, having talked to some of the circles and roundtables I've been in, is they want to know how. How do you get such great patient outcome satisfaction rates? And my answer is we touch and we listen. We touch the patient, we understand what they're saying, and we listen to what the patient has to say because we depend on our touch to come up with our diagnosis, our understanding of what the patient's history is, and we evaluate according to that. We don't have an easy, here's a prescription pad. And maybe that's not that easy. I take that back. But what we do know is that our hands are our vehicle for success for that patient. Low back pain care initiated with a doctor of chiropractic also, according to the research, saves 40% on healthcare costs in comparison to that which is initiated by a doctor of medicine. So, what are we looking at? If you haven't already, and I know 3,500 of you have downloaded our solution, Chiropractic Care, a safe and effective drug free solution to the opioid epidemic, do so and feel confident that you have well vetted information. We can't do this without the use of people that spend their lives looking at research. The schools, the majority of schools supporting us to help us ensure we've got quality information that you get to use. The CDC and the ACP guidelines, as you saw last year in April, just around this time, the Wall Street Journal actually used, instead of the word spinal manipulative therapy, they use the word chiropractic. Do we look at the FDA's educational blueprint for the healthcare providers involved in the management and support of patients with pain? Yes, look at that. Government supports the use of non pharmacological care. That's their statement. They want to ensure that our Americans are safe. Also, the Joint Commission came to agree. Now, if we're making a difference, we get that media will start picking us up. And one of those is the video and that Ohio did. And I'm just going to play a quick piece of that video.
Stop addiction before it starts. That's the role a group of regional chiropractors say they can have in the fight against the opioid epidemic.
Tonight, Danielle Cutterman explains how.
A beautiful evening for a dinner out, but those in attendance for this annual summer social know there is a serious matter at hand.
The time could not be better to encourage the healthcare community to start emphasizing drug-free alternatives.
Doctors with the Eastern Ohio Chiropractic Society say new guidelines recommend alternative treatment for back pain before medication. But they say this needs to be recognized by hospitals, physicians, and insurance companies.
What has to happen is the emergency rooms have to start using chiropractors first. Because if you give me 2 to 4 weeks with somebody, I can help them. And if I can't help them, I can find somebody to help them. And if they come see us first, I can keep them away from the opioids, and we can be a real big plus.
Attorney General Mike DeWine was in attendance for their gathering. He says pain medicine has a time and place for use, but should be limited.
I mean, we think that 3/4 of people who are on heroin or who are on fentanyl or carfentanil started with pain meds.
A scary number this group hopes opens the eyes and ears of healthcare providers across the state. With more local news, I'm Danielle Cotterman.
How exciting when you start seeing this type of coverage for us. And that's why we want to ensure that we empower you, that you have the information necessary. So when you do get a media contact, that you have the talking points ready, that you feel confident that you can educate and build with appropriate information. And that what they said there was educating healthcare providers, educating insurers, third-party payers, and also ensuring that we're communicating with the consumer. So policymakers are a big part. Now, what is the next, what's coming up for you? And we want to make it super easy for you. How simple can it be for you to just go out and educate? I also run a practice. I know that it's very busy and we don't have a lot of time to waste on other opportunities that you'd like to do, but you just don't have the time to do. So that's where the foundation can really assist you, is being able to educate. And some of the things that are coming up that'll be very exciting for you And again, we're trying to ensure that you pick and choose what's right for you. And I will show you a little bit later how you can manipulate those things that will make sure you're using what's right for your practice. We can't make everybody happy. Some patients don't want to treat athletes, or some doctors don't really enjoy treating a certain population. That's okay. You pick what's right for your practice. Posture, sports, employers, pediatrics, pregnancy, geriatrics. What about the military and our veterans? We certainly all want to join forces and help educate the consumer about over-the-counter medications, and also about opioid use. So we have a very exciting, and I want to put this out there so that you can understand that September is going to be a very important month. It's the Drug-Free Pain Management Awareness Month. It was adopted by the American Hospital Association in their healthcare calendar, and chiropractic started it, but we want to make sure that you're going to take it into your community and make it successful. So please look at September as, how am I going to do this in my practice? Okay. Why? The strategy for the foundation is you, the center. You're the nucleus of everything that we do. Because if you can take it from a local, your state associations can continue to expand those communications and ensure that the talking points and all of the other pieces that the national level, which is where the foundation is talking about. So I absolutely agree that this target and the center being the most critical is the grassroots. We like to say we start from the grassroots to, it's a top-down grassroots approach. And because we need you, and each time we come on to bringing our marketing presence to your community, we'll showcase our press releases, what we're doing in terms of advertisements in the local area. Oftentimes we'll be supporting your own state association. Maybe it's a legislative occurrence that's going to happen in your state, and we'll try to help as much as we can with the opportunities to educate. But always look for our infographics and posters and the other brochures that we've got coming out, because we're updating them on a regular basis. These are the talking points when you do have opportunities to maybe have a morning coffee with one of your colleagues down the street, is that you need to point out that we are a primary healthcare profession focused on the diagnosis, care, and prevention of disorders. We talked about this just recently, but I want you to understand that when we say the same things, we're going to be ensuring that people understand what we do. These disorders that are happening affect 44.6 million Americans annually, with a cost of $267 billion. And they're an increasing result of poor posture, workplace ergonomic issues, sports-related injuries, car accidents, or simply just a sedentary lifestyle. And I think even when you start getting into some of the local news, you'll start to see why chiropractic's messaging has never really changed that much. We're asking patients to do the right things. And 100 million people suffer with chronic pain. And the statistics are approximately 40 million a year suffer with an acute pain from an injury. So almost half of Americans at some point in the year are suffering. And that's why chiropractic needs to be able to showcase that we are a drug-free, cost-effective approach to their current pain. And so looking at the clinicians is a quote that I like to point out to you. Clinicians and patients should select, and this is from the ACP guidelines, non-pharm treatments such as superficial heat, acupuncture, or spinal manipulation. All right. 94%, that's our talking point, remember, is SMT is performed by chiropractors. Now, let's just do a quick look ahead at the Drug-Free Pain Management Awareness Month and what that looks like. It's going to be focusing on chiropractic, and we'll have more information as we get down, as you'll see. When we look at marketing your practice and you want to kind of help your front desk, maybe it's your front desk that's going to be helping you. It should take about 3 minutes for you to look at our roadmaps and then give to the front desk or your chiropractic assistant. This is a guide to local marketing success. Download it, use it in your practice. But what you should see is an email. When you join the foundation, you'll get a Monday marketing memo. Each Monday, you'll see, play the video for yourself. It'll take you 2 minutes on the way to work. All right. And then you'll be able to walk in and say, I got the Monday marketing memo, and this is what I want to use out of it. And how simple is it? Well, let's take a look. January, we saw our marketing roadmap go out week 1, 2, 3, and 4. It's as simple as just looking at what works for you. This is your practice and you know what you feel comfortable with. And if you look at, for example, when we covered January in the marketing of the baby boomers and our seniors, you could see that we've got a public service announcement that you could easily place on your website. And our Facebook and Twitter feeds, we need you to generate those. If you're not comfortable, call us. We'll walk you through it. Our members are very important to us. And if you're not a member, don't worry. We still want to ensure that chiropractic is getting out. So we've got a number of different free materials. But remember, when you donate to the foundation, you're donating to the profession. Our marketing dollars go nationwide. And the more we have, the more we're able to accommodate those media marketing moments. This is a great one-page document that you can download. It's called Chiropractic Care. It's a one-page flyer, and it fits nicely into a newsletter, and it also is very effective for healthcare because it has our latest research in there. So you'll see this coming in your March roadmap. Take a look at it, print it out, be confident that it has been well vetted. Now, continuing your own, sharpening your saw, as they say in your toolkit, you want to be up to date. How do you do that? Look, I don't have a lot of time, doc. What do you do for me? This is what we're going to do for you. March is chiropractic management of headaches. Communicating headaches is very important. What is the latest research? Well, we've got Dr. Cole. We tend to have some of the best in the profession that'll volunteer to help. And that's the key, that each one of these doctors are fabulous and they've got the latest information so that you can talk to your patients about what it is that theme is working on, so that you can put it on your social media. You can put it in your newsletters, and you can make those communications with your colleagues in your community. Now, don't forget, in March, very soon, we'll be at Parker, Las Vegas. ChiroSecure will be there as well. And I want to take just a quick moment to remind you that these ChiroSecure Facebook Lives happen weekly. And our next speaker that will be here at the same time is going to be Dr. Mike Misco, and he'll be your host next week. But I want to thank each and every one of you. Look at our site, see that it works for you, and let's be chiropractic strong, because together, that's where we all belong. Thank you so much for having me today. I look forward to joining you back here next month, when we talk about headaches, how to reach out to your community and let them know that you can help. Thank you so much. Have a fantastic week.